So where should we market to? So this particular section is talking about where I want you to start marketing your products and services. And these are very great information that you should start taking notes down, okay? So I want to be able to ask this. Tell me how you are marketing right now. I want to know how you guys are marketing right now. What you guys can do is this. Later on, create a quick short video right now about how you're marketing. What are you doing? Give me a 30-second speech, a 30-second USP, or a elevator pitch. And then send that to me. And then send another video telling me, now that you watch our program, this is what you're going to be doing next. I want to see your outlook on where you want to go and how you want to take things to the next level. Sometimes when I have our live events, I will have people come up and grab the mic and tell me how they currently are marketing, how they present themselves. And just within a snap, we can kind of adjust it and make it and improve it even better. So what are the current techniques right now that are being used? What are the current techniques of marketing? Just a typical drop off the brochures, a spaghetti type marketing. I'm going to send you a postcard. I'm going to go ahead and drop off and bring a full spread of lunches. Those are the typical current techniques, right? Now, here are the current trends though. Before we can learn the new things, let's talk about the current style of marketing. And I hope to get those videos from you guys so I can actually help you out even further. So some of the current trends that are going right now is people are going to senior fairs. Okay? If you haven't planned to go to a senior fair or haven't been to one, I suggest that you find out the nearest or the closest time of a senior fair in your area. Other people have their independent marketers. Some home health agencies, home care companies are doing health screenings in public. Some agencies are even taking care of their own employees as patients. And also there are some agencies, unfortunately, that are paying per patient. And this right here, ladies and gentlemen, I want you to be able to make sure you look up the Stark's Law, you look up the anti-kickback laws on why it is not advised to be doing these things. And I'll discuss a few things about that later on with you guys. And we actually have a full course just on the anti-kickback and Stark's Law that I suggest you guys watch. So some of these current trends, are good to do. Some of them will go to the nursing homes, will go to the hospitals, will go to the assisted living communities. These are great trends. Great trends. But the thing though is, how do we improve upon it? Can we improve upon it? Of course we can. And the next thing to ask is, do you maximize your marketing? If you're an agency that is existing already, do you maximize the most out of it? Do you have a referral close technique? Like for example, when we speak to a physician, before we even start a presentation, I ask them this. I said, doctor, before you even get started, because I'm absolutely going to know that you're going to enjoy our services, do you know any other physicians that would love to be able to hear more about our services and how it can improve their patients? That's what we call the referral close. Before we even start a presentation, I'm so confident enough, I'm going to ask for a referral. The doctor can say two things, yes and no. If they say no, great, let me go ahead and get started with this whole presentation. Then you can repeat that question later on. If a physician says, well, yeah, I do know, well, doctor, give me the person's name. I repeat this so many times, this referral close, because it's important to know and use. Another thing is, do you know your results? Do you actually monitor your return on investment? Do you actually have A and B presentation monitoring, meaning that you try the same presentation one way and a little bit and adjust it a different way again, but it's the same outcome? And do you actually go ahead and monitor to see what the results are, the return on investment? If you give a particular pen, if you give a particular cookie or a particular trinket, do you know your results? Some agencies have marketers and they don't even know the results that they have, and 6 months, 9 months later they realize I spent close to $50,000 and they only brought me 6 patients. Now, that is a lost money. You need to be able to know what you're spending on a monthly basis. Henceforth, you have to have your budget. You also have to have your expectations of your marketers as well. Do you have a policy and procedure for marketing? I said this earlier, you need to create a policy and procedure for marketing where literally anyone can walk in and start marketing for you. And the reason why I say that is because there's going to be times where your marketer is going to move on and move to another company, get a better offer. And you need to be able to expect that can happen. And when that happens, can you bring somebody off the street and literally give them the policy and procedures and tell them and give them a quick in-service so that they can start marketing automatically? Just like when you hire your caregivers, you give them an initial training. When you hire nurses, you give them an initial training. Do you have training for your marketing team? And I'm glad that you actually are watching this video, because this video is what it is. This is our basic home health marketing program. Crazy amount of information that should be shared with any new person in a company, that should be shared with your DONs, that should be shared with administrators, with supervisors, even with the field team as well, so that everybody gets everything in their head. What the company wants is success.